Hello, welcome everyone. I'm Allison Holmes. I'm a senior research associate in our research evaluation evidence and data unit at the Annie E. Casey Foundation, and I will serve as your moderator today as we discuss 5 ways the COVID-19 pandemic affected young parents in foster care. So first, let's walk through what our agenda will cover. So we're going to go over some communication during the webinar. I'll introduce our presenters, and I'll give you a little bit about how the foundation functions and what we hope to learn about in this study. Our presenters are going to walk us through the study and what themes they identified and discuss some of the implications for the future. We'll have lots of time for your questions, and we look forward to hearing what you are thinking about. And we want to give you some resources for learning more as well. So this is our panel. We have such an exciting panel for our discussion today. This is Liz Aparicio from the University of Maryland, Svetlana Spiegel from Montclair State University, and Alexander Sanchez is our youth co-researcher, and Tammy Fleming from the Annie E. Casey Foundation. I want to take a moment to go over some important housekeeping details for the webinar. After we hear from our presenters, we will take some time for questions, but please submit your questions at any time. We will keep our attendees on mute throughout the webinar, and we ask that you submit your questions by entering them in the Q&A window, which you see circled on the slide. You'll find that window on the lower right-hand corner of your webinar screen, and you can submit a question there to the panelists. If you are in full screen mode and want to ask a question, you may need to return to the event window by using the drop-down controls at the top of your screen. I will also mention that this presentation is being recorded, and the recording and slides will be available later at aecf.org. We wanted to give you a sense of how the Annie E. Casey Foundation approaches its work. The foundation focuses on strengthening families, building stronger communities, and ensuring access to opportunity, because children need all three to succeed. We advance research and solutions to overcome the barriers to success, help communities demonstrate what works, and influence decision makers to invest in strategies based on solid evidence. We make investments that encourage a focus on quality research and evaluation to learn what ideas and approaches are most effective for improving the well-being of children, youth, and families. Now, during the pandemic, we were seeing both anecdotally and through many quantitative surveys and the substantial and cascading impacts the pandemic had on parents and their children. However, there was a gap in the existing findings about the experiences of parents who are in foster care or had recently exited. There was an opportunity to center their voices and allow them to shape the narrative through a rich qualitative approach. Placing this in the context of other COVID work and what we know about young parents in foster care, the youth and young adult voices and perspectives can ultimately determine the lessons stakeholders should take away to improve systems now and prepare for the future. So now we'd like to turn to our panel and hear more about the study that was conducted. So I'll turn it over to our research team.
We're so excited to have you here with us. I want to tell you a little bit about our study team and partners. So this research was made possible with the generous support of the Annie Casey Foundation and Tammy Fleming in particular, who we appreciate a lot, and Allison's team also. But our team had a partnership of 2 universities, a community-based organization which helped us collect the data, and also youth co-researchers, one of whom is here with us. And we're going to introduce him a little bit later. So in terms of principal investigators, myself, my name is Svetlana Spiegel, as Allison mentioned, and my co-PI, Dr. Liz Aparicio, we served as the principal investigators for this study. We had a partner at the Healthy Teen Network, Dr. Genevieve Martinez Garcia, and she was our primary data collection person. So we partnered with the Healthy Teen Network to help us collect the data, which we're going to present today. And we also had two youth co-researchers, Alexander Sanchez, who is here with us. Alexander, can you wave your hands so we can see you? Thank you. And also Sheila Von Wirth, who is another youth co-researcher. Both of them are young parents with lived experiences in foster care. We also had on our team some graduate students from my university and also Dr. Aparicio's university who helped us analyze the data that we're going to present, and another collaborator, Dr. Rhoda Smith from Erickson Institute. We can have the next slide. So in terms of the design of the study, this was a qualitative research project that used multiple methods. We deliberately decided to do this as a qualitative project because we were interested in the depth of youth experiences. We wanted to hear in their own words and kind of using their own voice how this pandemic has affected them. In terms of our participants, we had 26 youth participating in this project. All youth were ages 18 to 26, and we had both young mothers and a few young fathers who participated in this project. In terms of the components of the project had two major components. We had a focus group and individual interview component, and we also had a photo voice project component, which Dr. Aparicio is going to talk about in a second. So we had 4 focus groups with young mothers, and we had 3 individual interviews with young fathers. And also, in addition to that, we had 9 youth participating in our photo voice component of the project. We collected our data from January to March 2021, so right at kind of the height of the second wave here in this country. So we had a lot of discussion and experiences that we've heard from our young people. If we could do the next slide. In terms of what we've done, we had a semi-structured interview guide for focus groups that we have used, and the same guide was also used for individual interviews. We asked a number of different questions and asked you to elaborate on a number of different topics. We wanted to hear how the pandemic affected various aspects of their lives, right? So what effect did it have on housing? How did it affect employment, finances, their health and mental health, also their family functioning and parenting? We also wanted to hear a little bit about their attitudes towards COVID-19 vaccination, so we had that component as well. And then we wanted to hear about the strengths and sources of support that they had, and also some of the services that they used throughout the pandemic. And the goal was to really get an in-depth view of what the youth had experienced in terms of challenges, and also what kinds of strengths and coping skills they had, and what kind of services were helpful for them throughout this difficult time for the country and for the world and for them. And if we could have the next slide. So Dr. Aparicio is going to tell us a little bit more about the photo voice component of this project.
Thank you. So youth have the option of whether to participate in the interview component or the photo voice component. And so those who chose the photo voice component participated in 3 sessions. And photo voice is a participatory action approach. So the youth actually have a lot of decision-making power over what happens in the sessions themselves. But the basic structure is that they come for, or in our study, they came for 3 sessions, and we introduced them to the photo voice method and kind of what was expected and how it would be used and what would happen with the photographs. And we asked them to show us their experiences during the COVID-19 pandemic and sent them out in between those sessions to take photographs of anything they wanted to related to their experience. So you're going to see some of those photographs here today. We're going to talk about the findings from both the interviews and from the photo voice sessions together, because they really complement each other, and I think you'll see that in terms of the takeaways from people's experience. All of our interviews for the photo voice and for the interview studies, actually, all of them were transcribed verbatim, and they were analyzed using thematic analysis, which helped us to identify prominent themes. Next slide, please. So a bit more information about who was in the study. So we had mostly young mothers who were in the study, and we had some young fathers as well. So we had 4 young dads and 22 young moms. And we had a wide range of races and ethnicities represented in our sample of folks who participated in this study, which you can see here. Next slide, please. So as Dr. Schwiegel mentioned, everybody in the study was aged 18 to 26 years, and they were about 22 years old on average. All of them were currently in or had recently transitioned from foster care. They had between 1 and 4 biological children, and also between 0 and 1 non-biological children. So youth could participate if they had their own children that were their biological children or others that they were parenting as well, which was a really important part of this study. People definitely talked about all the different kinds of parenting that they were doing. In terms of kids' ages, we had biological children aged from 4 months to 10 years, so a wide span there, as well as from 1 to 17 years for their non-biological children. So another large developmental span for our participants to be providing care for. This is the graph of the current living situation. So most of our young folks in the study were staying in their own apartment, or were staying with a spouse or partner who was either the parent or not the parent of their own children. We had some who were staying with a biological parent or relative, shared housing, some with the family of their child's father. And then we had some folks who were currently experiencing homelessness, whether they were staying in a homeless shelter, couch surfing, and then we had also some who were in independent living or transitional living program. Next slide, please. We had a wide range of folks from across the country. So all of the grayed out states are states from which our participants, or states that our participants live in. So all the way from Alaska, all the way across to the East Coast. And I'm going to now start talking a little bit about some of our findings. So we had 5 major themes. I'll talk about a few of them and then turn it back over to Dr. Schwiegel. So the first theme in all of our participants' experiences was the just extreme impact of the pandemic on folks' employment and related economic hardship. So I'll let youth speak for themselves here, and these of course are pseudonyms, but as Rose shared with us, I lost my job and I'm trying to figure out like bills and whatnot. Thankfully, our electricity has not been turned off because I used to pay the electricity bill and now we're so far behind, but they can't turn the electricity off during the winter here in Vermont. So you hear some protections there that Rose is talking about in terms of not losing their power. Chris similarly shared, I was working with the county, and right when they got the okay to shut everything down, they let a lot of people go. So like I was providing on that income, and when my job just left, it was so hard because of my 2, well at the time he was 2. He needed diapers and it was so hard to get diapers. As Angel shared, financially, I guess one of my biggest issues right now is probably food, because I used to get food stamps toward the beginning of COVID, and now, right now, I'm not. I have to reapply for them, but of food, and definitely like buying diapers and some of just like the essential things for my son is difficult right now because I don't have an income. So these are some of the things that youth in foster care who had recently transitioned out of the system are really struggling with. The next slide shows a photograph talking about Alex's experiences of needing to go to work, but really struggling, not having daycare and needing to go to work and being in that very tough situation and tough spot. Alex shared, it's good money, but I don't work as much. Without daycare, it's hard to get a better job or a second job right now. The young folks shared with us that they were in positions where they really had to physically go to work in order to be working. So they were, again, not able to telework. They were really in jobs where they had to be on site, which was extremely stressful during the pandemic, and just created a lot of issues with childcare. The next photograph shows some of this experience more, or Sam's experience rather, with this theme. No break even when you're on a break, she put here. I stopped going to work because COVID cases were spiking at my job, like someone was testing positive every week. So really speaking to the stress there. The second theme was educational challenges. So as Asia shared, I'm going to school because I'm a student and everything switched virtually. And it's really hard to connect and communicate with professors. So our participants were telling us about their own experiences and challenges with going to school themselves, as well as supporting their own children being able to go to school. It was just a very stressful time in terms of education. Angel similarly shared, so right now I've been trying to graduate for a while now, but when COVID started, it was difficult when it came to like when I was going into classes, and it made it really difficult for me because as somebody who's been trying to graduate for a while, I couldn't go in and do my classes. I couldn't go in and study. I couldn't go to get the books I needed because the library out here was closed. Juliet shared, for me, the impact it had was because of my mental stability. With COVID and then with all of the extra things that I was doing every day, and then not being able to go out and get that interaction that I needed, it kind of mentally impaired me from being able to focus on my classes. Like I would sit down, but my quality of work was just not what it should be. The effort and time, as well as the effort and time that I'm willing to put towards it. So even if youth were wanting to participate in school, this was a very, very stressful time to focus. And I know a lot of folks here may resonate with some of this experience too. The next slide is from one of our Photo Voice participants who was sharing what it looked like to be learning and working at home as a family, as she captioned it here. So while I try to work from home, my kids want to play. My kid doesn't like online school. He finds it hard to get up in the mornings and jump on the iPad. I'm going to now talk about mental health challenges.
Thanks, Liz.
Go ahead.
So the other theme that we really saw in almost all our participants is mental health challenges. And these mental health challenges really covered a wide spectrum of problems. And there were youth who had pre-existing mental health challenges. It talked about how the pandemic exacerbated these challenges and made them worse. And there were also youth who just talked about kind of new challenges because of isolation and loneliness and the stress that the pandemic brought. So if you can see here, Rose talked about this and she said, it definitely made me depressed. I mean, I didn't really go very many places beforehand, but I mean, now I'm like stuck home and can't really do much. So it really impacted my life and made me feel more depressed during the whole COVID. And Lily talked about how kind of the other challenges that the youth experience, they also have an impact on their mental health. And she said, I've been really stressed out. You know, I'm homeless. I don't have a car. I need to get a job, and then like lack of childcare, and plus trusting the place that I chose to put my daughter at. So I guess a lot of anxiety for me. I've always had really bad anxiety, but I think it's definitely worsened this year. So again, talks about the stresses of the pandemic and how it really interacted with some of her pre-existing mental health challenges and made them worse. And if you can have the next slide. Some young people also talked about access to mental health services and how they realized that they need help, but didn't necessarily find that the pandemic environment made it easy for them to get the help they need. So Hope said, now I don't know about anyone else, but it's really, really hard to talk to a therapist and try to work through things over the phone. So she was talking about telehealth and how everything abruptly transitioned online and how she struggled with that in terms of getting her mental health challenges addressed. You can have the next slide. And then some young people who didn't necessarily have significant mental health challenges talked about what the pandemic has done for them in terms of their mental health. And we know from research on other young people that this is not unique to our young people that are aging out of foster care. This is really a general struggle, but for our young people, it could have been an added challenge because of lack of support. And this is what Asteria said. During COVID-19, we were glued to our electronic devices. I needed help for my depression and anxiety. I didn't want to live like this. It was affecting my family too. We all needed a break. We love to go out on adventures. We've grown so much this last year. As a couple, we grew stronger in our communication. My children know we are in this together and we will get through the tough times. So you could see that really they talked about the strengths also, not necessarily, they talked about mental health challenges, but also the strengths. And I just want to bring to our attention here, I see here in the chat that some folks can't see the slides. Is that an issue for more than one person? Just wanted to make sure.
Right. If folks are on video, they may want to try logging in through another means and not having their camera on to see if that works.
Okay, great. And if you could have the next slide. And this is a photograph that one of our photo voice participants has taken, and he captioned that as sunshine on the other side. And this is what he said. Before COVID hit, we used to take a bunch of trips everywhere. Now I can't even think about going anywhere without falling into depressive thoughts like this is closed and that is closed. There is not even point in going. So taking my son to my bed in the morning and looking out the window and seeing him excited about this trampoline has helped a lot with that. So this young person talked about seeing a trampoline in the backyard and how his child was really excited to jump on this trampoline and how that helped with some of the mental health challenges that they've experienced together as a family. And if we can have the next slide. So just to summarize mental health, again, this is one of the most prominent themes that emerged in our study. We'll talk a little bit more about that as we summarize the findings. But I also wanted to talk a little bit about our next theme, and that is insufficient resources and barriers to service receipt. And this was something that, again, a lot of young people talked about. They talked about services that were made available during the pandemic, and they talked about how challenging it was for them to navigate the application for these services. And they talked about the fact that even when they were eligible for services, it didn't necessarily mean that in practice they were able to get it. So you could see Tita here, and she said the stimulus checks were based off 2019 taxes. And all the way up until the end of 2019, I was a ward of the state, so I was in OCS custody. So I was never able to get mine or get one for my son because I was claimed on someone else's taxes. And until now, I still have like no way to see how to get that money or how to figure that out. And Lily also said something similar. Since the stimulus checks went off the previous year's taxes, I wasn't able to get it. And that was a big need, or it is still a big need for my family. So I am still working on getting that or seeing how I could fix that. Yeah. So you could see that they knew they were eligible for some of the supports. They tried to get them and they really were unsuccessful. And perhaps there was a way to resolve these issues, but they didn't necessarily have supportive adults who could help them navigate the application process. If we could get the next slide. And I think this particular quote from Juliet really shows the challenge, right? I have access to everything, but sometimes I don't understand it. And so being able to get into touch with the right people that you need to, when you need to, especially when you have deadlines for stuff. And then all of a sudden you get something in the mail and they're like, you need to do this, this, and this. And it's like, okay, how do I go about doing this? There is not anybody there to turn around and be like, hey, this is how you do it. Let me sit down with you, show you, or talk to you about it. So really talk they really stress the fact that with all the stress of the pandemic and having to navigate childcare and having to navigate financial difficulties, navigating the application process was just an added stress that they didn't necessarily have, the mental energy or the supportive people to really help figure out. And that had a real impact on their access to services. So again, we're going to talk a little bit more about this at the end, but this was a really prominent theme that shows that making supports available is not enough. We also need to make sure that youth are able to take advantage of those supports, including being able to navigate the application process effectively. We can have the next slide. This is a picture that one of our photo voice participants has taken, and she's captioned that happiness in a box. I used to cook or bake something like rice, chicken, but now it's like a lot of work with him, school and work. My son should be eating better than that, but what can I do? Right? So she acknowledged that this is not very healthy for her son to be eating this, but the young people are really just trying to survive, and not having a lot of supports and resources means that they would have to fall down on some of the easier solutions. If we could have the next slide. And then the last theme, which we really thought was incredibly important, is the silver linings. So despite the challenges that youth have pointed out, and despite the difficulties that they've experienced and the stress and the lack of support, they were really able to see the good sides and some of the positives that the pandemic brought. And they talked about it, and they took pictures about it. And we really found that was really indicative of their resilience. So Hope said, I guess it's been also good because I've gotten to spend a lot of time with my kids and my newer baby. So I didn't have a job to worry about, like maternity leave and stuff like that, So I've gotten to kind of just soak in all the newborn baby stuff, and that has been good, right? So really kind of being able to see some of those positives. Can we have the next slide? And this is another young person who took this photo to represent some of the positive things that happened during the pandemic, and that is cooking home meals, right? And this is what she said. I just feel proud of the food that I can cook. That was her caption. And she said, growing up in group homes and spending time in hospitals, I never learned how to cook. I used to have to always eat out and spend money. To have your own place and actually make your own food feels much better. So she really talked about how that has been something positive that came out of a really difficult situation. And can we have the next slide? And this is another photograph that our young person Athena took, and she said, setting up the nursery with all the extra time I have. This is something that other youth also talked about. They talked about kind of having this time, which on the one hand was stressful because they realized that they weren't working in this time, and they had felt isolated sometimes and not necessarily sure how to spend the time. But also were able to see some of the positives and kind of the slowed down pace of life, because a lot of young people said that they always had to do a lot of things together, work and take care of their children and go to school, and just having a little bit of a break for something like setting up the baby room is something that some of these young people were able to identify as a positive thing. Can have the next slide. So I'm going to transition this over to Alexander to summarize for us. Now, if we could have the previous slide. Please, thank you.
Thank you. All right. So our first little bulletin, numerous negative effects of the pandemic on young parents. As you can see from the information presented, young parents who have been in foster care experience many negative effects from the COVID-19 pandemic. The main areas where these negative effects were felt included employment challenges, which are also brought substantial financial difficulties, disruptions in education, both for themselves and for their children, because of campus and school closures, and mental health challenges, which include new problems brought by isolation and stress, and also pre-existing problems that got significantly worse during the pandemic. The negative effects experienced by our participants are not different from the negative effects of all young adults experienced, but the magnitude of the impact is likely much higher because they have more limited supports and safety nets to fall back on during these challenging times. Our next little bulletin is services and supports, insufficient or difficult to access and or navigate. And speaking of supports and safety nets, our study also showed that young parents had difficulties navigating the application process for various services and resources that were made available during the pandemic, which often resulted in their exclusion from receiving these services. Young people talked about things like not receiving the stimulus payment or unemployment payments due to the various technicalities and difficulties with the application process. And many did not have the support of adults who could help them troubleshoot these issues. This shows that simply making these services available is not enough. We need to make sure young people know how to apply for them. And if they encounter difficulties during the application process, they need to have access to supportive adults who can help them resolve these difficulties. Mental health challenges that have not been addressed. We mentioned mental health problems before, but this deserves a separate discussion because this theme presented itself among almost every participant we interviewed. Young parents reported being stressed, lonely, isolated, sad, anxious during the pandemic. And those who had pre-existing mental health challenges found themselves struggling even more. We know from other research that many adolescent adults experienced mental health challenges during the pandemic, but it is most important to remember that our participants are particularly vulnerable. First, because most of them have experienced traumas in their lives and already had mental health challenges before the pandemic. Second, because they might not have access to mental health services or be reluctant to access these services because they have had negative experiences in the past. And this can have implications not just on young parents themselves, but also their children, since mental health challenges may interfere with effective parenting. We need to make sure that these young people have access to affordable, accessible, and culturally relevant health services during this crisis situations. Strength, resilience, and silver lining. Finally, we want to stress that despite multiple challenges we talked about, the young people in our study showed amazing resilience. They were able to see positives in the pandemic, such as more time spent with their children or learning new skills like cooking. They have had hope that things will improve, that they will persevere despite the challenges that they have currently experiencing. And this is important to remember. These young people have amazing strengths. They want to provide a good life for themselves and their children. They just need the right type of supports to fulfill their potential to the fullest.
Thank you, Alexander.
Thank you all so much for sharing those findings and all of the strengths that the young parents were sharing with you, and really a peek into their lives that we don't get to see that often. So thank you so much for that. Before we open it up to other questions, I just want to remind our attendees to feel free to enter any questions you have into the Q&A box. I had one question I wanted to ask the panelists. Was there anything in the findings that surprised you? Or was there something that you expected to find that didn't emerge? What are your thoughts about that? I'll just open it up there.
Oh, I could take that. I think one of the things that we were expecting to hear more about, but didn't really hear much about, is the role of the child welfare system in supporting the young people, right? So, and again, we have to remember that these are youth who are ages 18 to 26, and only some of them were still actively involved with the child welfare system. The majority were not. But really, almost none of our young adults talked about any kind of relationship with child welfare workers or caseworkers, either current or former. They didn't necessarily discuss any kinds of direct support that they received from the child welfare system, even those young people that did still have an open case. So we really didn't hear a lot about that aspect and how the child welfare system supports these young people. So again, this could be partially because of the age of our sample, right, and their older youth, and potentially it's disconnected. But it could also be because they're reluctant to go to child welfare for help, right? And we know that young parents in general who have been involved with the system, they really worry about surveillance. They worry that contact with the child welfare system might bring unwanted attention to their family and potentially get their children involved with the child welfare system also. So it's possible that some of our young people who really needed help and potentially could have gotten support from the child welfare system chose not to turn there and not to do that. So that was certainly a surprising or non-finding, I should say, because they didn't talk about that at all.
Yeah, thanks for that. That's an important piece to kind of lift up. Alexander or Tammy, is there anything that you wanted to add about anything that was surprising for you or anything that you wanted to expand on about the piece that Svetlana raised there?
Alexander, we can't hear you.
Whoops. I just thought it was very surprising to find out that how many services were out there that were available but weren't able to be utilized at all because of how we're set up. People just weren't able to either find them or complete an application process. After finding that out from a lot of our participants, I went to work and asked a lot of people about some of the more obscure services out there, and a lot of them have never heard of any of these services. So I kind of helped a lot of people out at work with that. But yeah.
And I think I'll add two things. One was, I think as we think about the reality of over surveillance and even the perception of over surveillance, I think it's on the side of the child welfare systems and those other stakeholders to really figure out other mechanisms to put in place for young families, right? So we already know these sort of perceptions and realities are in the environment. So when it comes to providing services, especially during this emergency time, we should think about it. I do think that is connected also, Svetlana, to the idea of navigators. I think it would have been, it should be proactive and it's not. But as we move forward, I think we should think about navigators. A couple of our partners have hired and made sure to have navigators to help with application processes, to make sure there's a person to call that a young parent could speak with, and just to help them through that process. It is assumed that everyone will know exactly who to call for what services, but that's an assumption that we should not make.
Yes, I absolutely agree with you, Tammy, and I think it's really important to make adults available to these young people, right? And not assume that after they leave the system that they are necessarily independent. We know from research and other general population that young adults don't really become independent from their parents until close to 30. So it's not reasonable to expect that these young people are going to become completely independent at a much younger age and with all the trauma that a lot of them have experienced, right? So it's not a reasonable expectation. You have another question here in the chat. So lastly, asks, I would have hoped to hear that some of the parents of young children were supported by home visiting programs. We have not heard that. Liz, correct me if I'm wrong. I don't remember any of our interviewees mentioning home visiting programs at all.
Yeah, I think we've had one person. Like it was very, I totally agree that this is really an opportunity for us to better support young former foster parents or former foster youth who now have children. It really is a potential opening since home visiting services are available to the whole population, and there's not that same concern that there is in reaching out to child welfare. I completely agree with you. But yeah, among all of our participants, only one talked about home visiting, and she loved having her home visitor come and felt that that was really a very, very important support to her during the pandemic, both for instrumental support, but also emotional support.
And kind of building on this question around support, another question that came in is, what do these findings tell you about how we should listen to young people and how they can demonstrate resilience with the right support?
You want to take that, Liz?
Should we just jump in?
Yeah, anyone can jump in. Go for it.
Sure, absolutely. So, I mean, Alexandra, we were just talking about this morning, right? With how striking that was with the findings that how resilient the young folks are, right? So, I mean, I think that what we've heard is that when the services are available and that they're accessible and there's people there to help youth navigate them, that youth are really ready and willing to engage with those services. And also that there is a huge amount of meaning making that's been happening through this pandemic. And I'm sure folks on the call can relate to that, that the pandemic has really made us all think through how we want to be living our everyday lives, and our participants absolutely express that and thinking through what did this mean for them and their families, what did it mean for them going forward. One thing that was really important that I think fostered that resilience was social support. We heard that youth who were, for example, able to avoid homelessness, it was because they had people that they could rely on, people that they could stay with. And so building out those social support networks is so important for fostering resilience.
And I think those supports fell on the side of the young mothers and young fathers, right? So a lot of the young mothers would talk about their in-laws and really being able to build on those support systems and live with someone on the baby's father's side. So I think on both sides, I do think in terms of the resilience, we must take advantage of this sort of opportunity with young parents, right? So they are resilient, but there's also this sort of added motivation when they become young parents. And by providing them with the supports that they need, I think we can accelerate, sort of improving the outcomes or the trajectory of the outcomes for the young parent and the child. So I think it is incumbent on us and stakeholders and providers, service providers, to really think about how do we build on that, and how do we, in terms of listening, there's some things that were mentioned earlier that I would think about if I was working with them. So there's the young person who talked about the utility bills. I think there's a lot of young people who say, okay, I don't have to worry about that now, but those utility bills are not eliminated. Eventually they have to deal with that. And we're putting these young families further and further back if they don't understand the mechanisms that's put in place, how long they will last, and then what is it that we do to help encourage them. Okay, whatever you get, let's make sure we're continuing to pay these bills, because eventually they will, you will be responsible for covering them. And so I think for providers and child welfare systems, that there's some things that we need to listen to, that's not listened for, that's not being explicitly said by the young people. But if we listen, we can begin to address some of the issues that are currently happening and that are potential pitfalls for the near future.
Mm-hmm. Can I mention something?
Please go ahead.
When I aged out of the system, 18, I moved out but I had no idea what I was doing. And eventually I lost I was living in a trailer at the time. I lost it and I was homeless for, I think, 2 weeks. Just living in my car. And I didn't tell anybody, not even my family, just because I was like prideful and I didn't trust anybody. So I went to my counselor because they were saying I was like failing my grades and everything. And she was talking to me. And I told her what was going on. And she bought me my first apartment. We went out that day and just got my first apartment. She helped me understand how to pay bills, how to save, which eventually ended up with me buying my first house. So the support systems are super helpful way. And I was able to pay her back and yeah, now have a family.
And thank you for that, Alexander. And I think this really stresses research on resilience really shows that young people who've been through difficult situations, even if they have one supportive adult, right, who could help navigate and troubleshoot some of these difficulties that they're experiencing, that can make a big difference in outcomes. And I think, Alexander, your example really stresses that, right? And we shouldn't assume that making something available is enough for people to effectively use it, right? Because without these supportive people, a lot of young people don't know what's available. And if they know what's available, they're not necessarily know how to access that in a way that's effective.
A really powerful example. Thank you, Alexander. Liz, were you going to jump in there? Sorry. Oh, we really appreciate that example. I wanted to turn to our implications. We've started dipping our toes into that, but I wanted to give the opportunity to flesh that out a little bit more. And just to remind folks, we'll have some more time for discussion after we kind of, again, flesh out these implications. There are so many ways that we can apply these findings, and so we want to have some more time for discussion after that. So I'll turn it back over to the team for that presentation, and then we'll have some more discussion.
So we talked, thank you, Allison. We talked a lot about some of the implications already, but I think one thing that should be stressed that really comes from the study is the need to be prepared for future emergencies, right? So our young people talked about this just hit, right? This just happened. And I think we know that a lot of the systems were scrambling to adapt and what to do and how to serve young people in this whole new virtual restrictive different environment and dealing with shelter-in-place orders and all of the things that happened in the beginning, right? So I think it's really important for our child welfare partners and other youth-serving systems to think about emergencies, right? What happens when it hits, right? And how can we involve young people in telling us what they need and how services could have been provided to them more effectively, right? So really planning ahead and incorporating youth voice in that planning, right? Really incorporating young people who've lived through this pandemic and this experience to help systems prepare for future pandemics. Because we know states have done different things. Some states have implemented a moratorium on aging out. Some states have not, right? Some states made other supports available and some states didn't. So I think having some more uniform guidance, preferably from the federal government, right, all the way from the top down, would have been really helpful in terms of planning. As we've mentioned before, making emergency supports available does not guarantee that youth are going to be accessing it, right? So when we make supports available, we also have to think, are we making this easy for the young adults who've been in the system to access those supports, right? What are some of the challenges that they can experience, and how can we mitigate those challenges, right, in advance to plan for those challenges? And young people, some don't know, and a lot of our participants, they found out about some of the supports during the focus groups when they heard from other participants, right? So at that time, they were, oh, I didn't know you could do that. I didn't know you could apply for that. Right, so this lack of knowledge is really it's really problematic, right? Because it's very hard to, all these systems are operating not necessarily in any kind of uniform way, so it's very hard to access this knowledge effectively. And then, as we've said before, even when they did know, and a lot of them knew, once something happened in the application and it didn't go smoothly, they didn't know what to do with that, right? They weren't sure how to navigate that. And some of them just gave up because the stress of navigating that was so significant that they said, it's not worth it. I'm not going to figure this out. So I'm just going to let that be. And then another thing that we've touched upon, but didn't really elaborate much, is what are some of the barriers for accessing mental health services among these young parents, right? That's mental health concerns have been expressed among, I would say, every single participant almost in this study. And not a lot of them talked about how they use mental health services effectively, right? And some of them talked about how they weren't able to access these services. So thinking about why is that an issue of availability and access, right? Especially during a pandemic. Is that an issue of finances? Is this an issue of trust or other kinds of barriers, right? Or potentially previous experiences that they had that weren't necessarily positive that make them not want to seek future mental health support, right? So really thinking about this and how we can make this better for the young people. Yeah, and I think we still have a few more minutes, so maybe we could take some of other questions potentially.
Absolutely. Lots of time for discussion and questions. And I think we're getting into so many deep issues that are bringing up pieces that, like many things in the pandemic, existed before the pandemic, and the pandemic was really just shining a spotlight on that. And so I appreciated some of the pieces that we were just raising in our earlier discussion, especially around those things where we've had those barriers to access, and the example that you just raised of, I didn't know, in your focus groups of, I didn't know about those services, and we're just hearing about that exchange in the peers. And so what I kind of want to like pull a little bit on that, we even had one comment come in terms of, we're thinking about the necessity for life skill and trying to connect that over into mental health challenges, and what are the role of systems in that, and wondering if we can maybe dig on that a little bit more. I mean, again, thinking about that, like, we know the pandemic has highlighted things that were already problems, and how do we piece some of these things together as we're thinking about our youth and young parents that are in foster care and how they're transitioning out, where we have these overlapping needs that are there before the pandemic, or how those things, and what are the roles of various systems in playing and addressing some of these needs and preventing some of the challenges that are arising. What are some thoughts that you folks might have?
I think one thing I would raise, as this has come up a couple of times around access, but I think it is important that we raise the idea around equitable access to this population, particularly even though this sample was very diverse. We know that the child welfare system is primarily Black and Brown young people, right? So if we're talking about access, I think we have to really begin to think beyond making sure services are available. We should be thinking about, are they experiencing the services the way we intend for them to experience those services? So you have a lot that was put in place, and there's one side of the coin that would say, well, we made it available. But if they're not experiencing the services the way they were designed, then we still have an issue. So as we begin to talk about access, I think we have to go beyond just saying that we've created and they are out there, but it is about, how are these young parents experiencing the services? How are they, getting in contact with folks, and what is put in place? I think the other piece that I would just add on, and then I'll step over, is this idea of helping them deal with the emergencies. We know even before the pandemic that the emergencies can derail a lot of work that has been put in place, even for those who have supports. So imagine those who don't have supports. So one thing, as we begin to think about life skills, is how do we make sure that not only that young people have an idea that when emergencies come up, there are ways that you can manage them, but it shouldn't be left to them. Svetlana and Liz had talked about, for another child who's not in the system, their parents are there up into their 30s, sometimes beyond the adolescent age, to support them. So we shouldn't say, oh, we train them on how to deal with emergencies without providing the necessary supports around them to make sure that they're able to put those things in place.
And I just want to, Yvonne, I see a question mark by your name, but I can't see the actual question. So I wasn't sure if I missed it or, Kate, do you see that too?
Yeah, Svetlana, I think that was the question that I had sent to you earlier that you all talked about life skills and mental health.
Okay, got it. Not familiar with this platform.
And looks like we had another comment come in, and just want to uplift this, that even the tone that the policies are written in is really significant because it signals the worth of these young people as well as the importance of the population to the child welfare system. That's absolutely true. There's so much that's communicated indirectly and just through tone, and that's absolutely true. So, I mean, Svetlana and I have been working to uplift the experiences of young folks in foster care who are parenting or experiencing a pregnancy. And I think that that's absolutely true. Many times they're really left behind and not thought about and not spoken to, in a respectful manner as the young folks who have the self-determination that they do. And we've talked a lot about young moms in the study and the disproportionate impact of the pandemic on mothers generally, including in this sample. But another really important thing that came out is fathers, and how much fathers are just not really spoken of because the services are not designed for them, the marketing isn't for them, the naming isn't to them. And so sometimes the dads are not even aware that some supports are available to them because they're not written that way. They're not designed with dads in mind. Alexander, I don't know if you wanted to add anything to that. You're on mute.
2 times in a row. Okay. Yeah, when I was helping people at work with the services, a lot of the dads had no idea what I was talking about. More of the women and more of the moms especially knew about these services, but none of the men knew what I was talking about at all.
Yeah, and I think it's a really important point about that. We wanted to enroll a few more fathers in our study, and and we really struggled to recruit young dads, which we probably talked about this every week in our research meetings. Why are we struggling to recruit young dads so much? And how do we recruit more young fathers? And we thought about a lot of different things. For instance, we recruited a lot through agencies that provide services to this population. And most of the services are provided to moms, right? There are not a lot of services that are specifically targeting young fathers. So that's been an issue, right? And even on social media, which is also an avenue that we've used to recruit young participants, when you talk about parenthood, a lot of the times it's sort of channeled to the mom, right? And young dads find themselves excluded. So in general, we don't have a lot of research and information on the experiences of young fathers aging out of foster care. And here in our study, we had this issue also, and we only had 3 young fathers that were willing to participate in the study.
That's an important point. But so with that, Alexander, maybe you would like to give the final word as our young father on the panel.
Absolutely. Yeah, this study opened my eyes a lot to some of the other stuff that was going on in the world. During this pandemic, I kind of didn't realize the broad effects of what was going on with everybody else. and how they experience everything. So this really opened my eyes to what's going on out there in the
Great. Well, thank you for that, and we appreciate all of your work and contributions. And thank you all for attending today. If you would like to learn more, we encourage you to check out a lot of these resources, including more of the research related to this project. There's the photo voice. There's another webinar about the COVID attitudes about vaccinations for COVID, and encourage you to check out the Reshaping Network. There's also some additional fact sheets in the toolkit about expectant and parenting youth in foster care. So please check those out. And thank you again for attending today and listening to all of this incredible work and centering the voices of our young parents in who recently exited foster care. So have a wonderful day and thank you so much. I hope you have a good one. Bye, everyone.
Thank you.